And I think there was a question about what the symptoms are of the
Yeah.
COVID-19, concern about like what you should be watching for. So the first thing would be fever. Any fever, even if it's mild grade, I would contact your physician and see about whether or not you should get testing. They may recommend, depending on where you are and the availability of testing, to just go ahead and quarantine yourself if you develop a fever. So I would definitely just contact your provider if you develop
Mhm.
a fever, even if it's low grade. And then the second thing is a dry cough and sore throat would be the main symptoms. But I have seen patients that are presenting with other symptoms like fever and diarrhea or gastrointestinal symptoms. So it can be varied. But definitely, if you feel like your health suddenly takes a turn, you're feeling more fatigued, even if you don't have a fever, I think it would be appropriate for you to just go ahead and contact your provider. They can talk to you about, like what risks have you had, who've been your potential contacts for COVID-19, because they may want not just necessarily to get you tested, it could be possible they want to get other people that you've been in contact tested.
Mhm.
So I think just if you have any concerns, just go ahead and contact your provider. I know I'm really trying to communicate with my patients as much as possible, and I would much rather have them reach out to me if they have questions than to stay at home wondering.
Mhm.
So I think that's the most important thing. Now is the time for allergies. I know in the Chicago area we're seeing a lot of blooming flowers, and so I'm starting to get like a little bit of a runny nose and like scratchy throat that I tend to get at this time. And a runny nose by itself is not COVID-19. Your typical allergy symptoms
Mhm.
are not typical of COVID-19. It's generally going to be a fever, dry cough, and sore throat.
Got it. That's helpful. I know I personally like feel like now every ache, pain, sneeze I have, I'm like, oh no, am I getting it? So it's good to refresh ourselves on those symptoms.